You know that little purple pill that you've seen on TV so much? You know, the one that advertises for Nexium and Protonix and Acifex, Prilosec and Prevacid and others? A little pill causes more problems than you might think. You can't just take the pill, go out, eat the whole pizza and have everything be okay. There's a price you pay for it. And this is what happens. When you take the little purple pill, it blocks the acid production in your stomach because these are called proton pump inhibitors, and that's what they do. When you have no acid, you just don't digest your food because you can't. There's no acid there to digest it. You also don't absorb B12 as you should, so you're at risk for developing the symptoms of B12 deficiency, which include an anemia, neurological changes, and even dementia. You can't absorb iron and calcium anymore because you have to have acid to be able to do that. And guess what? If you take that pill for about 8 weeks, about 40% of us will become addicted to it. And what that means is that when we try to get off of it, we'll get a rebound acid indigestion that causes all kinds of problems so that we feel like we have to continue taking the pill. It also causes it increases your risk for osteoporosis by about 45% and your risk for developing a senile dementia by about 18%. And when you're in the hospital, if you're taking that pill, it'll increase your risk for 2 infections. One, called C. difficile enterocolitis, is a very severe, often lethal infection that occurs in the gut, and the other is pneumococcal pneumonia. So what we have here is a pill that works well, but isn't good for your health, and causes lots of potential side effects like we've just discussed. So when you're thinking about eating that whole pizza, you better think again. There are many kinds of alternatives that we can use in natural medicine that don't have these side effects that are at least as effective, and ones that you probably should consider. So from my point of view, if you want to take the purple pill, best do it for a very short time, maybe a week or two, and then think of another approach.